And so, how are they typically distinguished in your office?
Usually we go through an extensive case history, like ask the patient a lot of questions. I've got dry eye as well too, so I'm a patient of this as well to just kind of talk about what's giving me issues. Because a lot of people think that is this just an age thing? Like, is it just because I'm old or something? No, we're seeing this of younger patients, middle-aged patients, and older patients just for a variety of reasons. So we go through an extensive health history just to make sure if there's any autoimmune or chronic inflammatory recurrent concerns that could inflame those the lacrimal glands to decrease the water supply. That's one thing we'll kind of use to eliminate, especially if there's any family history of anything like that. Another way we'll distinguish and differentiate the evaporative kind has to do with meibography, infrared imaging of the meibomian glands we do now at in our exams, as well as for patient care, but also triaging to see if there is any reduced T-butt tear breakup tests. Like we use the sodium fluorescein. It's like this yellow staining dye that just tells us how quickly the tear film evaporates. It's like kind of pouring water onto a hot concrete surface just to see if it dissipates really quickly. So those are just a few tests I use, and some of the docs use different tests as well too. But for me, just kind of where I've gotten a little bit of my passion in just seeing the T-buts, seeing the infrared meibography changes issues, and seeing if there's a prescription change that's a little bit undescribable. Do they work from home? Ask about lifestyle questions. Do they work on the computer a lot? Do they use their phone a lot? Do they have they taken up new hobbies like stitching? Because there's a lot of people over the past several years who have taken up new hobbies that it's just more than medical questions. Like, what do you do in your spare time for social enjoyment purposes? And then some people say, well, I've really gotten involved in X, Y, or Z, and I use a lot of that on my eyes every single day, 12, 14, 16 hours, whatever it is. So just really kind of listening and asking the questions, but get some scientific data to back up what we may be uncovering and listening to patients about.